Hello, and welcome to the Game Changers Fellowship webinar. I'm Beth Cameron. I'm a senior advisor at the Brown University School of Public Health's Pandemic Center. And today, my colleague, Professor Wilmot James, and I are going to speak about the Game Changers Fellowship, some frequently asked questions, and the program in order to provide more information for applicants or potential applicants. Next slide. So I'm a senior advisor to the Pandemic Center, and I'm joined by my colleague, Professor Wilmot James. Wilmot, over to you to walk us through the program.
So thank you very much. I'm a senior advisor to the Pandemic Center, and to say that at the Pandemic Center at Brown, our principal mission is to reduce vulnerabilities and to increase resilience to pandemics, other biological emergencies, and the harms they pose to health, peace, security, and prosperity for populations. What we're going to do today is share with you basic information about the Biosecurity Game Changers Fellowship and program, and I'd like to give you a very quick overview of what that entails. Is to say that the goal of the Changers Initiative is to establish a sustainable partnership and a replicable training program for early and mid-career professionals around the world to better prevent and prepare for what we call worst-case biological scenarios. And we're starting in Africa and the United States of America. That is our goal. What we like to do is join others in establishing a workforce pipeline, focusing in particular on prevention and what we call consequence management for catastrophic events, including accidental and deliberately caused outbreaks. These next generation leaders, part of the workforce pipeline, will develop skills and abilities to do the following things. First, to be able to rapidly assess emergency risk scenarios and to identify actions to prevent, to detect, and to respond to those more rapidly. Secondly, to develop a deep understanding of different types of biological risks. Third, to take recommendations and to put them into action, to translate those recommendations into concrete interventions. Fourth, to develop and pitch options and find and establish solutions to senior leaders and decision makers. And finally, to complete an impactful project in partnership with leading global institutions focused on biosecurity, biosafety, and/or pandemic preparedness and response. The next slide, please. So first, to establish partnerships, what we've done is on a university level, establish a partnership with the University of Stellenbosch in South Africa, and then with a number of global entities, including the Coalition for Epidemic Preparedness Innovations, IBIS, or IBIS, the International Biosecurity and Biosafety Initiative for Science, the Pandemic Action Network, Gavi, the Vaccine Alliance, and then with the United Nations Office for Disarmament Affairs, the UN, the support group for the BWC in particular, and then also with normative agencies, the African Unions, Africa CDC, and the WHO. The next slide, please. What we want to do is create a Global Action Network as a very active network of leaders based and radiating out of Brown University, involving Stellenbosch University and the Africa Center for Disease Control, the headquarters being in Addis Ababa in Ethiopia, but it's a continental technical support agency in public health. And then expand from there and find and establish in the course of time other partners in South Asia, Southeast Asia, South America, Australia, and Europe. Next slide, please. And then to evaluate the impact of what it is we are doing in order to establish replicability, so that we want to replicate this program at institutions in multiple continents, as I pointed out. Sustainability, we have to endure, and therefore biosecurity game changers are sustainably and constantly housed at organizations with biosecurity and pandemic preparedness missions. And finally, in terms of outcomes, have leading academic institutions on all continents build a pipeline for governments and global health organizations to lead forward in biological crises. And then to have a pipeline of diverse biosecurity capable experts serving in key global health security decision-making roles around the world. And if I can end off there by then handing over to my colleague, Beth Cameron.
Thanks so much, Wilmot. We're now going to walk through the specifics of the fellowship, and I want to just let everyone know that you can please drop questions and answers into the question and answer function in this webinar, and we'll be able to answer your questions and answers after we get through the fellowship specifics. We'll also be answering some of the frequently asked questions that we've already received about the fellowship since it's been launched over the last couple of days. Next slide, please. So the partnership platform that we're trying to create through Game Changers, which Professor James ran through, is implemented by the Pandemic Center at Brown, but has operational placement opportunities at a number of organizations. And Wilmot mentioned these, but I'll just quickly mention again: CEPI, IBIS, the Pandemic Action Network, the Biological Weapons Convention Implementation Support Unit, and Gavi. And we're consulting with international and normative entities, including the African Center for Disease Control and Prevention and the WHO, particularly the Global Health Emergency Corps. Next slide. The qualifications that we are asking for this fellowship include having a baccalaureate degree, so having completed an undergraduate level of experience, having at least 5 years of post-baccalaureate experience in a field that is related to health security. We're ultimately trying to target early to mid-career professionals from Africa and the United States. And you will be expected to work up to 50% time on an operational project team working with one of the institutions that we mentioned. Next slide. The materials that we're asking for include a curriculum vitae or a resume, a letter of intent that includes a personal statement of no more than 800 words. And we've included a number of questions in the application that we'd like you to address through that letter of intent, which in summary include your interest and qualifications, why you think biosecurity and pandemic decision-making and training need to change, your top 2 choices of organizational placements, how you would benefit from the described projects and what you would contribute, how the fellowship will help you achieve your career goals, very importantly, towards becoming a leader, and how you use the opportunity to build a network of next generation decision makers. We're asking for 3 letters of recommendation, and that at least one of those references is from your employer or academic institution, supporting that you can use up to 50% of your time to participate in this opportunity to make sure that you're able to take advantage of all it has to offer. Next slide. So a few more important details. The fellowship will include a stipend. That stipend will be between $20,000 and $30,000 US. That stipend will not include travel. Travel will be in addition, and we'll cover that when we get to the frequently asked questions. You will be asked to attend a workshop that will take place kicking off the fellowship, but also including other next generation leaders that will take place from September 3rd through 5th in Addis Ababa, Ethiopia this year in 2024. You will receive mentorship from colleagues at the Brown Pandemic Center in addition to being placed in one of the operational placements we mentioned. And you will receive a faculty appointment at Brown University at the School of Public Health. Next slide. So some important dates. The application deadline is May the 29th, 2024, end of business day Eastern Time. So that's 11:59 p.m. Eastern Time. The interview process will begin shortly thereafter, where we will be looking at your applications at the Brown Pandemic Center, and then we will be sharing your application with the placement organization so that we can find a good match. You will be notified of your selection if you are selected during the week of August the 2nd, and you will be attending, if selected, the workshop in Addis Ababa during the week of September 3rd through 5th. Next slide. So now Wilmot and I would like to run through some of the frequently asked questions we've already received, and then we will be very happy to answer additional questions, which I can see are already coming through in the webinar. Next slide. So I'll kick this one off, and then we'll go back and forth between me and Wilmot in answering some of the frequently asked questions, and hopefully these will also jog additional questions from people who are already online. So first, we've been asked if there are any citizenship requirements for this fellowship. So the answer to that question is there aren't citizenship requirements, but the fellowship is partially intended to build biosecurity networks among African and American early to mid-career experts. Therefore, we will give strong preference to applicants who are from and based in either Africa or the United States. Wilmot, over to you.
Regarding the second question, does one experience need to be specifically in health security? And the answer is yes. It is strongly preferred that the applicant has a background in health security and or a specific element thereof. And those elements may include areas such as biosecurity and biosafety, disease surveillance, laboratory capacity, non-proliferation of biological weapons and materials, antimicrobial resistance, and other elements of the international health regulations. Question 3, over to you, Beth.
So we've been asked how flexible the schedule will be for fellows. And to answer that question, each fellow will be expected to work up to 50% time, and the time frame will be negotiated with the fellow's home academic institution or employer and the placement organization. The fellowship is not a full-time opportunity, but it is intended to provide an in-depth experience for fellows as part of an operational project team. So sometime during the work week will be required in order to be able to fully participate in the fellowship and work with the host organization.
With regards to whether the stipend is inclusive of travel costs or are those separate, the answers are that travel costs will be separate from the fellowship stipend. The successful fellow will be expected to attend the workshop in Addis Ababa on September 3 to 5, which will be funded by Brown University in addition to the stipend. And if your host entity, that is the entity where you'll be placed as a fellow, wishes you to do additional travel, this would be negotiated with that organization once you are matched with it.
We've also been asked if you can apply if you're not currently in a current employment situation or not currently affiliated with any other institution. This opportunity is intended for people who are in the health security career track, who are early to mid-career, and who have an undergraduate or baccalaureate degree already. And we're focused again on building the next generation of health security leaders. If you're currently between positions, or if you're in a student situation, please note that in your application and include a reference from a former employer or a former academic institution.
So are master's and PhD students eligible to apply? Yes, indeed, you're eligible to apply if you have completed or are currently completing a doctoral or master's program. However, we are asking that each applicant has at least 5 years of experience and an undergraduate degree. The second requirement is that your host institution would have to agree to such an arrangement.
And then finally, is this a research opportunity? Can it be part of my dissertation? For example, my master's or my PhD dissertation. So this is really intended to be an operational experience to give you on-the-job training and health security in a catalytic and operational environment. While we encourage students to apply, the question of how this experience would fit into your doctoral or other dissertation program would have to be adjudicated with your host institution and also with your placement office. So with that, I think these are many of the questions that we've already been asked, but I can see that we're already receiving additional questions in the chat, and we'd be very happy to run through those. Next slide. So this is just to remind us to ask you to submit questions in the chat. And I think, Wilmot, we should just dive in. So I see that the first question that's coming up is, what are the criteria for becoming a partner? And I think I'm going to answer this to describe the partners that we've already outlined, including Gavi, CEPI, IBIS, and others. And the criteria that we used for reaching out to those partners and will include for reaching out to other partners is we wanted to include organizations that had a strong commitment to pandemic preparedness and response, a strong commitment to biosecurity and biosafety, in addition to disease surveillance and other elements of the international health regulations, and who would be able to provide a fellow with a really strong operational experience where they would get the opportunity to be part of a team that is looking at emerging biological threats and trying to come up with solutions to be able to be more prepared in the future, to be able to get ahead of emerging threats that may be unusual or unknown. And that would also be looking at, in addition to preventing, detecting, and responding, would also working closely with policymakers. We think it's really important through this program for fellows to get the opportunity to work with policymakers and to be able to impact policies on the national, regional, and global scales.
With regards to the second question, which is how are you defining 50% of time, 20 hours per week, or 50% of your primary workplace duty time, please remember that we are cutting across a whole range of countries with different sets of rules and arrangements and a kind of legal architecture around what it means to have a working week. Principally, what we have in mind is that half of your working time is spent devoted to a project associated with the fellowship. And whatever that half of the working time is something that we can certainly sort out on a case-by-case basis. But typically it means in a 38-hour a week, it's 19 hours spent on the fellowship. So we're quite flexible in terms of how that's structured, but to say essentially half of your working time is spent and devoted to this project.
Yeah, and I would also add to that we think that, you know, we obviously want this to be a strong commitment, as Wilmot outlined, of time, but also the importance component is that you'll be able to integrate into a project team working with the organizations that we described, that you'll be committed to that, and then outlining how that will work on a regular basis will also be part of your discussion with the placement when you interview. So I'll take the next two questions. They're both quite short. One, what is the duration of the program? And the answer to that question is 1 year. And that will start in September of this year. And where we and our host institutions, I think, will be flexible about the end date, depending on whether you're a student and have specific programmatic needs for the following academic year, or whether you're in a different employment situation and might be more flexible. And then the second question, is this the pilot launch for the fellowship? And the answer to that question is yes.
So the next question about an epidemiologist from a local or state health department in the US that hopes to have a future career in global health security be a good candidate. I would say yes, absolutely a good candidate. So remember that we're dealing here in particular with accidental and deliberate outbreaks, which of course we share with natural outbreaks in terms of some of the methodology to deal with it. So, but to answer, that's a very good match being described. Everything else being equal in terms of 5 years of experience or so, and being in a career track clearly that leads in the area of health security.
And it looks like the next three questions are pretty much identical, asking how long is the fellowship? One of them outlines that it starts in September, but when does it end? And the expectation is that it would be approximately a year, so ending in August of the following year. But again, we recognize that some fellows or applicants will be in an academic situation where there might need to be some flexibility. And we anticipate that that piece, exactly when the end date will be at the discretion of the fellow working with the host institution. But we're anticipating 1 year for the fellowship, so roughly ending in August of 2025. The second part of the third ask about this question is it open for prospective fellows working in non-governmental organizations? And I think the answer is that the employer needs to commit to the 50% time requirement, as Wilmot outlined earlier. And I think that will be up to you and your employer. We don't have any preference for specific types of employment situations that fellows might have, so long as they have the 5 years experience in health security and the other application requirements.
So the following question about from the microbiologist with a PhD, yes, you are certainly qualified, as I indicated. In terms of the pages for CV, we're looking for a resume more than a 50-page curriculum vitae. So, and if you need any more information, we'll ask you, but a resume of 2 to 3 pages would be ideal. So should your application include specific diseases you'd like to work with? I would say no. It should be disease agnostic. We are interested, obviously, in dealing with infectious disease outbreaks with epidemic and pandemic potential, but we're actually disease agnostic. So if Beth can take the next questions.
Sure. So the next question is if we can provide some more details on what we mean by operational experience and what that would entail, what kind of tasks fellows would be expected to complete. And yes, the questioner is correct that this will be specific to the host institution. But as an example, we are one of the organizations that we're working quite closely with is the Coalition for Epidemic Preparedness Innovation, CEPI. And the program that we're working with is the new CEPI Biosecurity program, which is run by Dr. Andrew Hebler, who has joined CEPI to look at ways that CEPI can build biosecurity and biosafety into its existing programming. And so I anticipate that those kinds of placements in that type of a placement would entail working with a project team that is working with research organizations in different parts of the world, on R&D projects and discussing biosafety and biosecurity applications of that work. They're also working with policymakers on how to build biosafety and biosecurity into funding decisions that organizations in research and development or who are working on the 100-day mission to improve medical countermeasures development and delivery might have. So I think it'll be a range of different types of tasks, ranging from working with organizations that are funded by the institution to working with operators on the ground who are trying to improve pandemic preparedness, to looking at specific types of case studies, like specific emerging infectious disease threats that we need to be prepared to combat. I anticipate, however, that there'll be a range of different types of qualifications that might be looked at depending on where you could go. For example, communication skills might be particularly important if you're going to be working with a wide range of organizations. Some of the placements might be equally interested in someone that has a deeper research background. But again, this will be dependent on the opportunities that are provided and your own interest areas as well.
As for the question about age limit, let me just say that there is no age limit, but we are interested in individuals early career and mid-career. That usually means that we are looking at a specific kind of population of graduates who are in a career track and at the early stage and early stage career and mid-stage career. So let me just say that. In terms of the question regarding besides attending the workshops, will we be required to be outside the office? You are expected to attend the workshops, clearly, as part of this fellowship, and any other travel that you negotiate with your employer, that's relevant. So I'm going to ask my colleague Beth to deal with a question to do with the stipend and covering of salary at their companies.
Sure. And also there is a question about sharing the presentation that has just popped up, and we absolutely will share the presentation after the webinar. Is the stipend intended to cover a portion of the fellow's salary at their company? The stipend is intended to provide an incentive for applicants to be able to spend 50% of their time. We're not looking at specific salaries that people might be making and trying to match that. The stipend, once again, is between 20,000 and 30,000 US dollars, and the flexibility in that range will be dependent on the years of experience that you have. But it is intended as an incentive and not intended to match a certain portion of your existing salary. And I think in terms of the question about whether 5 years experience post-baccalaureate is a hard cutoff, the answer to that question is no. We put it into the fellowship application as a recommendation and a strong preference in order to connote that we are looking for people who are serious about the career track and health security, as demonstrated by having worked in the field and looking to take a next step that could be really important for them in their career track. But if somebody is really close to that or demonstrates that they have an analogous type of experience, we will consider that in the application.
Regarding the question about somebody with a health policy background, yes, just remember that we're looking at a spectrum when we speak about health security, right? So from public health to national security, that's the spectrum. So anybody who falls within that spectrum clearly has the background knowledge that's required. We answered the question about additional travel. So in terms of the number of fellows, we are talking about 1 fellow per placement. And we are dealing essentially with selecting 9 to 10 fellows.
In the question about whether the stipend will be a one-off payment or paid monthly, that's a great question. I think the answer is that it's paid monthly, but we will get back to that. We'll get back to you. And the way that we will do that is we're going to post the frequently asked questions that we outlined in the slide presentation earlier online in a document. And we will add more information about this issue when we post it so that we can answer this question properly. There's a question here about what if you change employers during the duration of the year? So what if you have an anticipated career change? I think that is an excellent question. The goal of having a letter from your employer or academic institution is to make sure that you're not put in a tough situation with your commitment to the fellowship. And so if you know that you're going to be changing careers and you know that you're going to be going to a specific new employer or a new academic experience, it would be useful to note that and to make sure that you have their agreement that you're able to spend 50% of your time. Obviously, there are things that come up that can't be anticipated, but we really do want to prioritize, especially since there's a limited number of fellowship slots, people who are able to spend that 50% time and who are in a comfortable situation with their current employer or academic institution to do that.
I think you should keep going, Beth.
Okay. Is prior research experience necessary or considered in the application process? Well, only in so much as we are, again, looking for people who have that 5 years or equivalent experience post-baccalaureate. We anticipate that many of our prospective applicants will have research experience, but we're not looking for a very specific type of research experience. We're looking for experience in health security. That could be in policy, it could be in research, it could be in academic training. We, again, are looking for a wide range of trained individuals for this fellowship. And is resigning from one's current job advised if selected for the fellowship? No, we're not advising people to resign. It's a half-time opportunity and it's a stipend. And so we want to make sure that people are able to continue to live their lives and to maintain their livelihoods. If that is something, if you're entering an academic situation that is the appropriate way forward for you, I think that makes sense. But we are really looking for people who are in a career track. And we anticipate that many of our applicants will be employed with a health security related job already. And they'd be able to spend part of their time working on this fellowship opportunity in addition, or be in an academic training situation.
So with regards to the question about the HSPA project, for those who don't know, that's the Health Security Partnership in Africa project that's coordinated by the WHO Hub in Berlin. And it involves Africa CDC, the Robert Koch Institute, and the Global Partnership. So that is not a Brown program, but you can clearly see what the linkages are there in terms of content. So, so those two are not formally linked. The question about partner institutions, that would be best for someone with an interest in disease surveillance. So as you can see, those institutions that we have listed as placement institutions have their missions, and you can check what those missions are. But they would be involved in supporting fellows who are immersed in a program such as this, as a policy program dealing with health security that is actually very practical and requires a knowledge that can be translated into interventions when it comes to pandemic response, including for accidental and deliberate outbreaks. So that's the best match that we need to find, and disease surveillance is one element involved in that. So back to you, Beth.
Yes, and on the question, while we're not formally linked to HSPA, I do want to say that we're really proud to be building on the network of biosafety and biosecurity experts that has been built through that program and others on the African continent. And we're really proud to be consulting with organizations like Africa CDC as we build this program so that it is part of a sustainable network. Can the experience gains before attainment of a bachelor's degree count? So here's a question about how we're counting the 5 years of experience, I think. The answer to that question is we will absolutely take into account all of the experience that you have in health security. Again, this fellowship program is for people who are in a health security track, career track, and are dedicated to that track. But we are going to be a little bit flexible in how we look at that background. We want to make sure that we do get people who are committed to that track wherever their experience has fallen in their training. Do pharmacists fall into the category of health security experts? Yes, we are asking for people who are in a health security track. So if you happen to be a pharmacist who is working in the area of health security, that would certainly be part of an application. That would be an application that we would absolutely happily welcome and consider. And then maybe I'll just take this next one and then turn it back over to you, Wilmot. What organizations can be potential employers, I think you mean for graduates of the fellowship program? And the answer to that question is we are not able to place people post fellowship. That's one of the reasons that this is a program in conjunction with existing employers that you have and academic institutions, is to help further training along the track that you're already on. But we are hopeful that this will increase opportunity in terms of bringing to fellows' attention additional career track opportunities and jobs, and also that it could generate additional opportunities in this field for you as fellowship applicants, and also for others in the future. We are trying to grow the field and the opportunities for you locally, nationally, and internationally.
In terms of the question about the duration of the fellowship, do we need to also be at Brown University? The answer is no. You'll be at your partner institution for the duration of your fellowship, but you're clearly linked to Brown University. And we're certainly looking at seeing that for the duration of the fellowship, there'll be some kind of faculty appointment as well. So thank you for saying that this is a brilliant initiative. We're going to put a lot of effort in making this a superb opportunity for those who are placed. So thank you very much for that compliment. We're looking forward to working with our partner institutions to make this a great success.
So there's a question here about what is the biggest challenge for prospective fellows that are placed? This is a really thoughtful question in addition to the others that we've received. I think the largest challenge, I think, for prospective fellows is just going to be prioritizing your work. I think this is a part-time opportunity. I think it's going to be exciting and invigorating. And we definitely will need fellows who are self-directed and able to work independently with organizations that are going to place a really high value on learning from you, as well as providing you with a learning experience. So I think that's one of the largest challenges. But Wilmot, what do you see as a large challenge here for fellows?
Well, the key thing is that this is a policy program and it involves gaining operational experience, which I think is valuable. So you have an academic, many of the candidates will have an academic background, but not operational experience, and the placement will provide you with that. So the successful fellows would have to master that environment. I think it's an exciting thing to tackle, but you have to shift gears in terms of what it is you're doing, because operational interventions have consequences. And so this course is to see whether we can refine your skill in fact, making the right sets of decisions and then implementing those interventions in a way that's successful.
That's so well said, Wilmot. I completely agree. During the application process, should fellows outline the placement that they're most interested in? Yes. So we'd like for fellows to look at the list of placements and let us know which you are most interested in. That will help us as we're looking at potential matches and interviews for different fellowship placement opportunities. And information about that is also included in the application. And I think we answered part of this last question. Is there any after fellowship deliberate programs? Not currently. Again, this is a catalytic program. It's new. We're hoping to be able to expand it, and we don't currently have a specific after fellowship program, but we are going to be maintaining this network. So there will be opportunities to stay connected with the program and with current and future fellows, but we don't currently have a specific program intended for fellows. But watch this space because that's certainly an area that we'd like to grow. I think with that, those are all of the questions and answers that we've received for the webinar. This is obviously being recorded, so you can come back to them, and we will be submitting an updated document with some of the answers to these frequently asked questions online so that you'll be able to see them. Oh, I see that we have an additional question, and since we have time available, if there are other questions, please do drop them in. This is a question about the University of Stellenbosch. Wilmot, do you want to take this one?
So presently, the University of Stellenbosch is a partner, and so we've got a member from the University of Stellenbosch sitting on our steering group, and they're participating also in the short courses that we'll be offering next to the fellowship program. So will they host fellows? No, right now the fellowship fellows will be hosted by the partners we've identified.
And we have another question that's come in. Can we rotate between two partner institutions? No, currently what we've worked out with the partner institutions is that the fellows would be available for the entirety of the year. If there's a specific case that you want to make, feel free to make it in the application, but I think it's unlikely that we'll be able to offer that in this first placement. And will there be any additional placement organizations added to the current ones? And if so, when will they likely to be added? For this placement, I think the fellowship organization placements that we have listed are the ones that will be available. If we have any that will be added, they would be added before the fellowship interviews begin. And so that would be before June. And we would identify that through our website online if we were to land with additional fellowship placements. I think that's unlikely. It is possible, but it is unlikely. How does the placement with Brown Pandemic Center differ from the other placements as it's managing this fellowship? So we are going to place some fellows directly with the Brown Pandemic Center, and there will be two ways in which that could work. One is that the Brown Pandemic Center will host the fellow formally, and the fellow will work with one of the partner organizations that we identified, and that could happen in the event that that is the most logistically easy way for the fellow to work, depending on where that person is located and depending on what the requirements for that specific operational placement are. So it could be that you're homed with Brown University, but working with one of the partner organizations. That's one option. The second option is the Brown Pandemic Center itself has a number of exciting opportunities where we're working on biosecurity and biosafety in the United States and globally, particularly with the African continent through Professor James's work. And there is an opportunity to place a fellow directly with us working on one of those projects.
So the question about percentage of time spent. The reason why we set it at 50% is that we want the fellows to spend a focused period of intense work and to take it seriously enough. And so we don't want it squeezed by employer expectations in terms of time. So that's why you have a 50-50 split. So that's what the desirable mix is in terms of time spent. In terms of the Africa CDC, presently it's not a hosting partner organization, but it's certainly a strategic partner. It is obviously Africa's normative body when it comes to providing technical support to this area of work across the continent. So it may become a placement organization as the fellowship grows, but for now it's a partner organization. One of its senior members sits on our steering committee as well.
And we do anticipate that organizations like Africa CDC will be helpful in getting the word out about the fellowship opportunity and also helping to build linkages between people who are part of the fellowship and who are part of other activities on the African continent that are related, including National Public Health Institute networks and including the biosafety and biosecurity work that we've already discussed. So a critical partner, the Africa CDC.
So it seems like there are no further questions, in which case, if you agree, colleague Beth, Cameron, we are leading to closure. Just to thank you very much for your time and particularly for your interest. We think this is an exciting opportunity and we're so pleased to be able to share its details with you. If you have any further questions, you can see what we'll post on our website and certainly be able to respond if you send an email to get to the email that's dedicated to this program, Game Changers at brown.edu. Beth?
Just thank you. Thank you to you, Wilmot, for your dedication to this program and the work that you are leading as a part of it and related to it. Thanks to the Pandemic Center team, in particular, Amanda Kogan, Aquiel Person, and Bentley Holt, and Michael Mitchell, who helped to put this together today. And thanks to all of you for excellent questions and for your applications. We're really excited for this first cadre of Game Changers Fellows, and we can't wait to get to know you and work with you. Please don't hesitate to reach out with additional questions. Thanks very much.